Ladies and gentlemen, after a rapid rise in infection over the months of June and July, the daily increases in infection recently appears to be stabilizing. There is a noticeable decrease, particularly in the larger provinces, the Western Cape, Gauteng, Eastern Cape. However, KwaZulu-Natal still provides some challenges, but we hope it will decline soon as well. Over and above the improved national case recovery rate and more than 80% of infected people are recovering, the fatality rate is also less than 2%. This suggests that the prevention measures that South Africa and all South Africans have implemented have been effective. This was confirmed by the Minister of Health, who informs us that there is now sufficient hospital capacity, including ICU space and ventilators. Consequently, we have called for a temporary suspension on the building of field hospitals and will be redirecting to maintenance and repairing existing facilities. As we continue with our fight against this COVID-19 virus, we aim to limit hardships, and there is no desire to leave stringent prohibitions in place when they are no longer necessary. It is for this reason that we've lifted the restrictions on a number of areas, but have maintained the curfew between 10 p.m. and 4 a.m. Inter-provincial travel is now permitted. Basically, what it means, traveling around South Africa is permitted. The sale of alcohol at off-sale and retail outlets is permitted, albeit with restrictions. Off-sale only between Monday and Thursday from 9 to 5. Alcohol will be served also at places like restaurants, bars, taverns, where they are licensed. These establishments can operate, but only with a maximum of 50 patrons, so long as the health and hygiene protocols are observed. These include washing of hands, sanitizing, wearing of masks, and also 1.5 meters distance. Of course, whilst people are eating and drinking, they take off masks, but in between they have. We have also opened up gyms and fitness centers, and they are also permitted to conduct business with a maximum of 50 people and subject to strict health and hygiene protocols. So fitness and gyms are allowed to have 50 people at a time. So during the day, they'll probably have lots of people, but at any one time, they should only have 50. Restrictions on beaches and parks have been lifted, but also subject to prevention protocols and directions to be issued. The resumption of water-based activities and certain categories of tourism activities, including boat-based whale watching, scuba diving, shark cage diving, kayaking, river rafting, speedboat rides, are also open, subject to health protocols. Certain environmental sector activities are opened, including zoos, aquaria, animal sanctuaries, and rehabilitation centers, subject to strict health and hygiene protocols, including sanitation, wearing of masks, maintenance of social distance. To further mitigate the risk, the Department of Health is working with the relevant departments and sectors to develop guidelines. Hospitality and entertainment business such as accommodation establishment, tour operators, and casinos operate at 50% of floor capacity. Theaters and cinemas are now permitted to operate at a maximum of 50 persons at a time, subject to health and hygiene protocols such as mask wearing, social distancing, sanitizing, washing of hands. Social events at places of residence are now permitted. These include visits to friends and family, so long as there are no more than 10 visitors at a time, and the health protocols of wearing masks, sanitization, washing of hands, and safe social distancing are observed. I think this is very important to emphasize because people, when they visit, they'll be probably visiting people who are over 60, some of them, who have comorbidities. So nobody would like to visit and find that, because younger people, sometimes they carry the virus without knowing they are positive. And you don't want them to come home or to visit a grandmother, aunt, uncle, or whatever, not knowing that they are positive, and then infect the older people. And we know that the older people are at risk. Their mortality rate is high. So it's important that when you visit, you still stick to the protocols. You still wear your mask, sanitize, and keep your distance so that your visit should not lead to grief. So it's very important. Social gatherings such as funerals and weddings are now permitted as long as there are no more than 50 people gathered. But all have, and we've learned from other countries who opened up nightclubs, they had to close them pretty fast because the virus was just moving as fast and as energetic as the people at the nightclub. So to limit the risk, we have also implemented restrictions of spectators at sporting events. No spectators are allowed. Cruise ships for leisure are also not allowed. We also alluded to the fact that all our efforts are directed at the delicate balance of saving lives and livelihoods, to which end we must say the strategy was a dynamic roadmap that would strive to maintain relevance and advance our fight to protect people, but at the same time secure livelihoods. We wish to thank all South livelihoods. We wish to thank all South Africans, individuals, traditional leaders, NGOs, workers, women's organizations, business people, youth organizations, and every single South African for their contribution to the fight against COVID. But the fight is not over. Please continue. Even though we have eased restrictions, the risk is also increasing, for it is people who move the virus. We must, with vigilance, defeat the virus together. We must soldier on, work together. Indeed, it's all in all our hands, and it's not done until it's done. We still don't have a vaccine, we still don't have a cure, so let's continue. I thank you.